Okay, today we are going to talk with Mr. Smith, and Mr. Smith is here to have, right now we're going to be going in the room and giving him 500 cc's of sodium chloride to run continuously, 125 milliliters an hour with a drip rate of 83 drips per minute. He's going to have it continuously, and he has GTT tubing of 10. So he has an anticubital line and IV line, and so we're going to go in there and start the procedure to give him his IV fluids and his cefazolin. So I'm going to knock on the door. I'm going to introduce myself. I'm going to say, hello, Mr. Smith. My name is Lisa. I'm your nurse today. I'm going to go start, I'm going to sanitize my hands, and then I'm going to come up and I'm going to check your name band, and I'm going to ask you your name and date of birth. And I see that you said your name is Mr. Smith. You gave me your date of birth, and your medical record number matches what I have here on my chart on the computer. So we're all good to start. I'm going to ask him how he's doing today, take some vital signs, and do a quick assessment of the IV line area. I'm going to palpate it. It's not hot, it's not tender, it's not swollen, the skin looks good. There's no infiltration, not painful or anything like that. So I'm going to go ahead and now wash my hands again. I'm going to put on my gloves, and then we're going to go ahead and hang all this. So the first thing we're going to do, so we've made sure that we have identified our patient. We have the right drug. It's the right time to administer it. This is the right patient, the right dose, the right route, and the right medication. So we have the sodium chloride, and we also have the cefazolin. So we've identified all of that. So what we're going to be doing now is we're going to take an alcohol wipe. I'm going to clean the IV site here, and we're going to make sure the line is painted. I'm gonna push it up a little bit, take the cap off, get a little bit of the fluid out, and then we're going to go and screw this on here and push it, and we're going to flush the line. Okay, so the line looks really good. It's not painful, it's not infiltrating, it flushed really easily, and so I think we're okay with that. So the next thing that we're going to do is we're going to take our IV line tubing here, and we're going to open this up. All right. And then we're going to puncture the bag. And prime the tubing. Okay, make sure it goes all the way through. I'm going to hang that. Okay, and so now what I like to do here is go ahead and take these gloves off. So I'm going to take these off. I'm pretending that I'm throwing them in the garbage. I just don't want to waste supplies here for school. I'm going to wash my hands. Okay, again, I'm going to put on a new pair of gloves now. And I'm going to take another alcohol wipe. I'm going to clean the port here again after we flushed it. And then I'm going to take my cap off. And I'm going to hook up my patient here. All right. Okay, I'm going to open the clamp, and I'm going to make sure that this is hung by gravity. That's what the orders say. But if I had a pump, I would set it to the 125 milliliters an hour. The pump would do the calculations for me, but since it's by gravity, we either can use a clamp that's on here, like a roller clamp that says how many to set it to, or we can use our watch and set it to that drip factor and just basically count the amount of drops for 1 minute and just make sure that we have it right. So now that that's going, the next thing that we're going to do is we're going to take our sodium chloride and we're going to puncture that bag next here. So I'm going to take my gloves off. I'm going to sanitize my hands. I'm going to put more gloves on. Now I'm going to touch this new tubing here. And this is the cefazolin, the antibiotic. So what's going to happen here now, we'll put this up here. We're just pretending that this is an IV pole. Obviously it's not. So what we're going to do now here is we're going to clamp, make sure our sodium chloride is clamped, okay? And then this actually will go into the sodium chloride tubing. So what we'll do here is we'll take another alcohol wipe. We'll wipe this off, okay? We're going to take the cap off here. Make sure that that cefazolin is clamped before you take that clamp off. And what we're going to do here is attach it in here and make sure that it's running open. This, so what you're going to do here is make sure that the sodium chloride is clamped, and you can even clamp it up here as well, because you want this to be running. You want the cefazolin to be running to the patient. So this is, we're going to open this up, make sure that it's flowing down to the patient, that the patient has no pain or discomfort during the procedure. The IV site still looks good. I'm going to take off my gloves, okay, and then I'm going to wash my hands again. And then when I come back, I'm going to disconnect the patient and make sure that the patient tolerated the procedure well and that there was no complications or anything like that. So it's pretty straightforward procedure. Again, I'm using gravity, but you could also be using a pump. This table is all sanitized with wipes and let to dry before we even gathered our supplies and set anything down. Okay, so I will take off, disconnect the patient after the procedure, and that's pretty much how we're going to be doing this. Thank you.